Kegel exercises have become one of the most widely recommended practices in modern women's health, particularly for strengthening the pelvic floor, preventing urinary incontinence, and improving sexual wellness. Although the exercises themselves are deceptively simple, contracting and relaxing certain muscles, the effects they can have on a woman's body and life are far-reaching and transformative. To truly appreciate the significance of Kegels, one must first understand how the pelvic floor works, why it weakens over time, and how daily practice can restore not only physical function, but also emotional confidence and intimacy. The pelvic floor is a group of muscles, ligaments, and connective tissue, forming a supportive sling across the base of the pelvis. For women, this network holds up the bladder, uterus, and rectum, helping them stay in the proper position. When functioning optimally, the pelvic floor muscles provide control over urination and bowel movements, maintain vaginal tone, and support core stability. Yet these muscles are constantly challenged throughout a woman's life. Pregnancy stretches them as the weight of the baby presses down. Vaginal delivery may cause tearing or trauma that leads to lasting weakness. Menopause reduces estrogen, which lowers tissue elasticity and muscle tone. Even simple lifestyle factors like chronic coughing, constipation, obesity, or heavy lifting can strain the pelvic floor until it no longer provides the same support. The consequences often show up as urinary leakage, sometimes just a few drops, when coughing, laughing, or sneezing, but for many women, it becomes an ongoing embarrassment that affects daily life. Beyond incontinence, weakened pelvic muscles contribute to a sense of looseness in the vagina, decreased arousal, and difficulty achieving orgasm. These problems may be common, but they are by no means inevitable, and they should not be ignored or accepted as a normal part of aging. The story of Kegel exercises began in the 1940s when Dr. Arnold Kegel, an American gynecologist, introduced pelvic floor training as a non-surgical treatment for urinary incontinence in women after childbirth. His innovation was groundbreaking because it empowered women to take control of their own health through self-directed exercise rather than relying solely on medical procedures. Over decades, countless studies have confirmed his findings. Consistent pelvic floor training reduces urinary leakage, enhances bladder control, improves sexual satisfaction, and prevents prolapse of pelvic organs. What makes Kegel exercises unique is their simplicity, accessibility, and discretion. They require no equipment, can be done anywhere at any time, and no one else can tell that you are doing them. A woman can strengthen her pelvic floor while waiting at a traffic light, sitting at her desk, or lying in bed at night. Yet, despite their simplicity, the key lies in performing them correctly, consistently, and with mindful awareness of the right muscles. The first step is identifying the pelvic floor muscles accurately. The most common method is to try stopping the flow of urine midstream, though this should only be done as a test, not repeatedly, since it can interfere with bladder function. The muscles used to stop urination are the same ones that should be trained during Kegel practice. Once identified, a woman can begin exercising by contracting those muscles, holding the contraction for 3 to 5 seconds, then relaxing for an equal amount of time. This counts as 1 repetition. Beginners may aim for 10 repetitions, 3 times a day. As strength improves, the contractions can be extended to 8 or 10 seconds each, with 15 or more repetitions per session. Like training any other muscle group, gradual progression is important. Over time, these small but consistent efforts build resilience and control. The benefits for urinary control are profound. Women who once felt anxious about leaving home without sanitary pads for leakage often report complete resolution of symptoms after several months of practice. In clinical settings, pelvic floor training is one of the first-line treatments recommended for stress urinary incontinence, the type triggered by coughing, sneezing, or physical exertion. By tightening the supportive hammock beneath the bladder and urethra, Kegel exercises reduce the chance of involuntary urine loss. This not only spares women embarrassment, but also liberates them from the subtle restrictions they may have imposed on themselves, avoiding exercise classes, hesitating to travel, or steering clear of social gatherings. Regaining bladder control restores a sense of independence and dignity that cannot be overstated. Equally significant are the effects on sexual function. Stronger pelvic floor muscles increase blood flow to the vagina, which enhances natural lubrication and heightens sensitivity. Women with toned pelvic muscles often describe more intense and frequent orgasms. They may also gain greater control over vaginal contractions during intercourse, which adds to their own pleasure and that of their partner. This newfound control often rekindles sexual confidence, especially for women who had felt self-conscious about looseness or dryness after childbirth or menopause. Some even discover types of orgasm that they had never experienced before, such as those triggered by rhythmic contractions of the pelvic floor. These effects are not merely physical. They ripple outward into emotional intimacy, improving communication, closeness, and satisfaction in relationships. Pregnancy and childbirth are key moments when pelvic floor health is most tested. During pregnancy, the weight of the uterus places tremendous pressure on the pelvic floor, and hormones relax connective tissues in preparation for delivery. Women who practice Kegel exercises during pregnancy may find it easier to push effectively during labor and are less likely to experience severe tearing. After birth, pelvic floor training accelerates recovery, reducing the risk of long-term incontinence or prolapse. For women who undergo cesarean delivery, Kegels are still beneficial because pregnancy itself weakens pelvic support. In this way, pelvic floor training becomes an essential tool not just for treatment, but also for prevention across the reproductive life cycle. Menopause is another stage when Kegels prove invaluable. Declining estrogen leads to thinning of vaginal walls, decreased elasticity, and reduced blood supply, which combine to make sexual activity less pleasurable and incontinence more common. Regular pelvic floor exercise counters these effects by promoting circulation, maintaining muscle tone, and preserving the ability to control the bladder. For older women, Kegels may mean the difference between continued independence and the discouragement of needing adult diapers. In this sense, they are not simply about sexual pleasure or vanity, they are about dignity, autonomy, and healthy aging. Of course, like any exercise, technique matters. Many women mistakenly tighten the wrong muscles, such as the buttocks, thighs, or abdominal wall, while neglecting the true pelvic floor. Others hold their breath, which increases intra-abdominal pressure and undermines the exercise. Proper form involves breathing normally, focusing attention inward, and isolating the pelvic floor. A helpful visualization is to imagine lifting the muscles upward and inward, as though trying to gently draw the vagina up inside. Some women benefit from using aids like Kegel balls or devices with biofeedback sensors that confirm whether the correct muscles are contracting. These tools are not necessary but can accelerate progress by providing reassurance and motivation. Psychological benefits should not be overlooked. Urinary leakage often brings shame and social withdrawal. Difficulty with sexual satisfaction may erode confidence and strain relationships. By practicing Kegels, women reclaim agency over their bodies. Even before physical changes appear, the very act of taking control fosters empowerment. Over weeks and months, as tangible improvements emerge, this empowerment blossoms into restored confidence, a renewed sense of femininity, and greater willingness to engage in social and intimate life. Modern healthcare recognizes pelvic floor training as part of comprehensive rehabilitation. Urologists, gynecologists, and physiotherapists frequently prescribe Kegel programs for women with incontinence, prolapse, or postpartum weakness. In some clinics, therapists guide women through sessions using electronic biofeedback or gentle electrical stimulation. Mobile applications now act like personal trainers, sending reminders, offering guided routines, and tracking progress. This digital support reflects a growing awareness that pelvic health is central to overall wellness and deserves consistent attention. Importantly, Kegel exercises are beneficial for women of all ages, not just those with current symptoms. Young women can use them preventively, ensuring pelvic resilience before pregnancy or aging occurs. Middle-aged women can strengthen their bodies against the changes of menopause. Older women can preserve continence and sexual vitality well into later life. In every stage, the practice is safe, effective, and sustainable, requiring only minutes a day. Consider the impact of a practice so discreet that it can be performed while commuting, watching television, or cooking dinner, yet so powerful that it can transform the quality of life. This is the essence of Kegel exercises. Small, invisible actions with monumental results. In a culture that often promotes expensive treatments, surgeries, or medications, Kegels stand out as an empowering, cost-free solution. The only investment required is commitment. Imagine a woman who once dreaded going to exercise classes for fear of leakage. After months of consistent Kegels, she returns to the gym with confidence. Another woman, once anxious about intimacy due to dryness and diminished sensation, finds new joy with her partner. A grandmother who had begun wearing pads daily to cope with incontinence now plays freely with her grandchildren, no longer bound by embarrassment. These stories are echoed in countless clinics and households, testifying to the life-changing potential of a practice that demands nothing more than awareness, discipline, and perseverance. Kegel exercises are more than a medical recommendation. They are a philosophy of self-care. They remind women that health does not always require complex interventions. Sometimes it lies in reconnecting with the body's natural strength. Practicing Kegels daily is like watering the roots of a tree, invisible to the outside eye, yet essential for growth, resilience, and vitality. As women integrate them into their routines, they cultivate not only stronger muscles, but also deeper self-trust and confidence. In the end, pelvic floor training symbolizes empowerment. It demonstrates that aging, childbirth, and hormonal change need not dictate a decline. Instead, with consistent practice, women can preserve control, enhance pleasure, and embrace every stage of life with strength and dignity. Kegel exercises, simple yet profound, offer every woman the chance to take her health into her own hands. Literally anywhere, anytime, silently and powerfully. And from that daily choice arises not just stronger muscles, but a stronger, more confident self.